was a cocktail waitress, and I was having a hard time seeing out of my right eye. For like 2 or 3 days, I had a heck of a time seeing out of my right eye. And then the next morning I woke up with this god-awful pounding headache. Feels like your eyeball is being pushed from the back out of your eye sockets. I went to the hospital and ran through a gamut of tests and was told, my neurologist came in and said, you've got MS. And I said, this is gonna sound stupid, but what's MS? When I was 25, my husband and I went on vacation. When I got home, I could feel nothing from here down, including my kids hug me. That was devastating to me. So I'd always tell them, come around back, so I could feel, something. And, sorry. That was a really hard thing for me. They put me on Solumedrol, which is a steroid. Then they had me on Avonex. I started researching things like vitamins and minerals and supplements and you name it, I've at least researched it, and I never thought I'd walk again. Not with a walker, not with crutches, not with cane, nothing. I never ever thought I would walk again.
Every physician has the capacity to be a pain management doctor if they want to pull out a script pad and write out a prescription for narcotics. And for many years and decades, that was kind of the go-to process. In fact, there was a pretty strong push by all the pharmacological companies. There was a lot of money to be made by simply writing out a prescription and have a person take a medication that everybody understood had other addictive components to it as well, but it had a proven treatment effect. But the unfortunate truth with narcotics is after a while, those effects tend to wane, and the problem that caused the pain was never formally addressed. In 2016, more people died from narcotics than died in the entire Vietnam War in 1 year. Heather came to us with a long medical history that was very complicated. Underlying everything was a history of multiple sclerosis. And she was wheelchair bound when we saw her, and with a lot of back pain. And she had pain in other areas as well, but a lot of back pain and leg pain. My practice specifically does not use narcotics and attempts to provide a precision diagnosis for the actual source of the pain. We have the ability to go in and stop the transmission of the pain signals in the spinal cord before they get to the brain with what's called a spinal cord stimulator. Under light sedation, we place 2 small catheters in the epidural space, just like a woman who has a labor epidural. Now, in some cases, it might have some significant reduction. In other cases, it may completely block all signals of pain. Really kind of a light turned on for her, and we realized that this was probably our best bet. After getting authorization, we finally put her through a spinal cord stimulator trial and had remarkable success with her pain. She got to the point where she got up out of her wheelchair, and on her last visit, she walked into the office. It really was, it kind of brought tears to everybody's eyes.
When he saw me walking, he came up and gave me a big hug and brought the entire building in to see.
And after that procedure, she came in with a pretty dramatic change in her symptoms. So what that sparked was a discussion between Dr. Lewis's clinic for her newfound ability to be able to get up, move around with a lot less pain. And so the decision was to put her in with physical therapy and try to take advantage of that. And she really ran with it, made a lot of improvement.
Heather was great. The first day she came in, she's very witty. She has a great sense of humor.
She was full of energy. We used to do laps around the gym, and I started off telling her how many laps we were going to do. And by the end of her therapy session, she was telling me how many laps we were going to do that day.
I can put my watch on all by myself, and I know that's small, but it's really not. It's really amazing the things that you take for granted. And you don't realize what it is you take for granted until you lose it. And that could be anything from your sight to your feet to being able to hug your kids.
I don't think anybody has ever seen one true, comprehensive pain management center. If you talk to any family practice doctor, the most common reason for a patient to see a physician is pain. And so it's not an uncommon presentation. It's certainly not, we're certainly not lacking for referrals. What we'd like to do is to make sure that every component of their care can be accomplished under one roof or one campus at least. That's what we will be able to supply. Well, my hope is to see groundbreaking in the next month. So hopefully by next summer, we're actually seeing patients in that new facility.
Well, long term, I'm going to be a billionaire. Not going to happen. My goal, my actual goal, on May 28th, 2019, is mine and my husband's 15th anniversary. I'm going to walk into a restaurant with him on his arm and out.